Hello all, welcome to another video of EM Simplified. So today what we are going to discuss is how to detect an RV myocardial infarction from ECG. So you know right ventricular myocardial infarction. So whenever we say myocardial infarction, it can be infarction to the left ventricle, right ventricle, also the septum. But it is very important that we should know how to detect an RVMI. So how will you detect that in the ECG? So whenever a patient is coming to you in the emergency department with chest pain, you are taking an ECG and you are seeing ST elevation in lead 2, 3 and AVF. That is the time that you have to think about, am I dealing with an RVMI? So what are the clues that will give you, okay, possibly I am dealing with an RVMI infarction? The clue number 1, ST elevation is more in lead 3 than in lead 2. So that is the first clue that will give you, okay, probably we are dealing with an RV infarction. The second clue that you need to look in is ST elevation in V1 and there is ST segment depression also in V2. So that is another clue that can help you in guiding, am I dealing with an RVMI. So when you typically place the leads, the right from V1, V2, V3, V4, ideally the V1 is only looking into the right ventricle. So the rest of the others are not looking into the right ventricle. So whenever you are having a suspicion or you are having a patient with an inferior myocardial infarction, it is mandatory to take a right-sided ECG. So how will you take a right-sided ECG? That's a very important question. So you wanted to take a right-side ECG. There are two ways. One is you can just reverse everything from left to right. So keeping V1 in the left second intercostal space, V2, V3, V4, V5, V6, like that you can go. Like you place in the left side, you can place similarly on the right side, and you can look for ST elevation in V3R and V4R. So V4R is the classical one. Or else what else you can do, V1 and V2 you don't change, only you replace, only you keep it V3, V4, V5 and V6 on the right side. So V1 and V2 you can keep it like that itself. The rest of the leads you can move to the right side. So these are the two ways by which you can take a right-sided ECG. So it is very much important that whenever you get an inferior wall MI, 40% of the inferior wall MI can be an RV infarction. So to look into the RV infarction, we need to take a right-sided ECG, and in right-sided ECG, we have to look for ST elevation in V4R. That is a classical. So what is the most important, another point is that whenever a patient with RVMI with hypotension is there, you have to give more fluids and NTG should be avoided. We have discussed already that in the previous video. So whenever an RVMI patient is coming with hypotension, you have to give fluids. So remember that how to detect an RV myocardial infarction in an ECG. Thank you.